welcome. I'm Sean Baxter, Senior Vice President with Healthgrades, overseeing our health system and provider business, and really excited here today to be hosting Ty Aderhold from the advisory board to discuss why artificial intelligence matters in healthcare. So I think probably all of us are inundated at the moment, from every conference session to all the emails we get daily, that AI is here in a big way. Likely has staying power, and then also wondering what to do with it, right? There's so much out there that it can lead to a bit of paralysis on how to implement, if you should implement. And Ty's got some great material today to help you wherever you might be on that spectrum. Today really is about you and learning how the experts at the advisory board have distilled all this information. From a Healthgrades perspective, it's really important to us to be a part of this and help our clients' understanding and knowledge in the AI space. Big reason for that, earlier this year, we formed a strategic partnership with MedChat AI, and we are their exclusive partner in the health system and provider space. Ty is going to cover a broad spectrum of AI applications, including some interesting clinical ones. Where Healthgrades and MedChat AI really live is in the patient journey and operational efficiency landscape. And so we'll be here after the fact for questions, certainly for follow-up. But again, today's really about you and distinguishing those differences from our vantage point, right? We work in things like patient acquisition, engagement, throughput. We're helping our clients automate every part of that patient journey. So that starts in, triage through scheduling, script refills, even bill pay. And then we really help in manual bottlenecks where humans have traditionally done jobs, but can, again, really filter in that automation for tremendous cost savings and efficiencies there across the board. So enough about us for now. I will go ahead and turn it over to Ty to get into the details here, and then we'll follow up on the back end. But thank you very much, Ty, and welcome.
Thanks, Sean. Glad to be here with you all today to talk through why AI matters, and really, as Sean mentioned, to help you all sort of regardless of where you are sort of in your AI journey. To do that, our agenda for today will start with just a sort of 101 overview from the top, just to make sure we're all on the same page with terms. There's so much jargon out there, and I think especially as Sean mentioned, as you get email outreach and almost inundated with different materials, it can be hard to understand sort of even what you're seeing. So we'll start at that 101 level, then we'll move into sort of what is the real potential opportunity here? Where is this hype coming from? Why is this potentially something that's going to transform the healthcare industry? And then we'll also spend some time, though, understanding a little bit of the flip side of that. What are some of the big threats? What are the things that if we don't solve for, we don't mitigate for, could really derail some of that opportunity? And then finally, how do you take a principled approach to adoption? How do you start to move forward on adopting AI today without sort of jumping in too quickly? So with that, let's start with that 101. And I start every AI presentation I give with a slide because I think it's very useful, especially for non-experts who are starting to hear more and more about AI and interact with it on a daily basis. So in this slide, I'm really just trying to lay out sort of what is AI and what isn't. I particularly like the right-hand side of it here, where you look, you have robotic process automation on the left, all the way through artificial general intelligence on the right. This is sort of a general spectrum of what you might consider sort of automation and AI adjacent technologies. Looking at it on the left, robotic process automation, this has been around for decades at this point. This is really just sort of automating processes and analytics based on preset rules. You can think of it as an if-then statement, if you will. I would personally say this is not really AI. This is just automation. Still very powerful and important, but doesn't necessarily fall into what we consider AI. Moving to the right from that, you have advanced statistics and predictive AI. And this is where we start to get into actual artificial intelligence, It's been around for a decade plus at this point, and the line is quite blurry between sort of what is just an advanced statistical model and what is actual AI. I don't want to spend too much time on that today. I think the bigger takeaway here is that this idea of predictive AI that infers information to make a prediction or to make a decision is where we're starting to see some advancements in AI technology. Certainly, the ones that we've seen in radiology over the past 10 years have mostly fallen into this predictive AI camp. Then you have generative AI, which has brought around sort of the latest hype around AI. I'm sure we're all aware and we've heard of this at this point. This is different from predictive AI basically because of its output. So its output, instead of making a prediction or its output being something that is derived from what was put into the model, it's actually creating new content through pattern matching. You can see this in text and ChatGPT, but also images, videos. There's a whole really field of generative AI that has sprung up in the past few years, and we're seeing sort of a huge impact across sort of many businesses, including healthcare, in terms of can we do things more efficiently with the use of generative AI. And then you go all the way to the right to artificial general intelligence. I put this here and on the slide because I want to talk about it, but the caveat is we are so far from artificial generative intelligence. This is the idea of a sentient AI that really can mimic human intelligence across a wide variety of tasks, and we are not close to that. So even though generative AI, you go to ChatGPT, it can seem like it can do all these different things. The actual scope of what it's able to do is still very narrow in terms of responding to particular questions, providing back information. It is not close to that general intelligence, and we are not close to that. So as you think about AI tools and AI tools available to healthcare, we're still really in a world where you're looking at tools that are developed for specific tasks, trained to do those specific tasks. And if you ask them to do something entirely different outside of that task, they're not going to be able to perform very well. So that's a general overview of sort of what is AI. I'm sure there are plenty of other terms you have heard: computer vision, natural language processing, machine learning. All these are really sort of subcategories of artificial intelligence, different methods that AI models use to reach their results. I like to think about these sort of subcategories based on sort of what their function is to start to understand sort of what they are offering. A great example of this is the sort of flow chart you see on this side, which comes from Karen Howe, a researcher at MIT. Her chart is a little more complicated than this. I sort of condensed it down to nicely fit on a slide. But the basic idea is, you see something like machine learning. You may not understand exactly what that means, but if you start to break it down of like, okay, what is the function here with machine learning? It's both, can this model reason? Is this model looking for patterns in the data? Then it's using machine learning. Another example, natural language processing. Can this read? And then can this model read what you type? Then it's sort of using natural language processing. So all of those sort of jargony terms, I think, if you start to break down into, okay, so what is this actually accomplishing or doing with the technology, starts to make it a little more clear what it means when a given organization says they're using a machine learning model, or they're doing a pilot with computer vision. Speaking of sort of where healthcare is headed in terms of adoption, I think we have in the past few years, really since the rise of generative AI, seen sort of a massive amount of hype around sort of AI tools and their potential to transform healthcare. On the one hand, I think that's very much because these are amazing new tools that are available. I do also think there are some other market forces that are pushing leaders towards considering these new solutions that they may not have otherwise considered. And I pulled some data points on this slide to illustrate that. Overall, I think if you look at what is going on in healthcare today, you see that quality is becoming harder to sort of maintain. We're seeing increases in adverse events. Workforce shortages remain. This is, been I could have put this on a slide each of the past 5-6 years, right? Like workforce shortages remain an issue. We're seeing inpatient revenue erosion, and we're seeing capacity concerns. And the reason I pulled these 4 data points is when you take them together, you're really looking at a set of issues where healthcare leaders are tasked with needing to potentially improve quality, um, have sort of like increased capacity concerns, don't have the staff currently to be able to solve some of those challenges, and are sort of losing, sort of getting tighter operating margins. So they don't have the easy ability to go hire more staff or to go sort of buy a bunch of new solutions in order to solve these challenges necessarily. So it creates this world where there's not a lot of money to solve the challenges, and there's really tough challenges without staff to do it. And in that world, I think the sort of shining light at the end of the tunnel in some respects can be a transformative technology like artificial intelligence, something that can support staff to accomplish some of these goals, to accomplish and solve some of your biggest challenges efficiently and with an ROI. And with that, I want to pull up some data just quickly on what we're seeing in terms of health system adoption of technology. This was just a quick pulse survey that we ran last year. You can see sort of some of the titles of who was involved in the survey, but more importantly, how many vendors are you working with? I pull up this slide because I think it's a good gut check for organizations. Most organizations are working with 1 to 2 AI vendors right now. I think that is a good place to be. I think you're seeing, you have early adopters who are maybe up to that 4 or 5 plus level, but it's not that many. You also have a group 20% almost at 0 vendors. I think that is the group I expect to change most. In the next couple of years, if we ran this again, would expect to see that 0 vendors be much smaller. I would expect the 1 to 2 vendors to stay pretty large. I think we're at a point where organizations are picking a few vendors they want to work with in the AI space to sort of get their feet wet and start to understand the processes of how do we manage AI governance, how do we do the change management around some of these technologies. I'll get to more on that later when we talk about adoption, but wanted to pull that in up front. Another thing I wanted to pull out from the Pulse survey is really who's involved in making some of these AI decisions. Here you can see, unsurprisingly, the majority is the existing IT governing body. The piece I want to pull out specifically is just that 27% of organizations have data scientists involved. And again, I pull this out to say, it is somewhat rare for organizations to be able to lean on data scientists when evaluating AI solutions. So that is not, do not feel behind if your organization does not have data scientists that are able to help out with this. Do not think that should sort of preclude you from getting involved in the AI space. There are ways to sort of move into this space without having some of that expertise in your staff. But certainly if you have access to data scientists, they can be very helpful. Again, more on that later. And then finally, what are the main business problems your organization is trying to solve? No, not surprisingly, the 2 that jumped out: clinical workflows, minimizing workforce shortages, and burnout. And I think the key here as well with the workforce shortages and burnout that I want to call out is that can be both sort of on the clinical side and in the non-clinical space, because there are so many tasks that we ask staff members and clinicians to take on today that can be augmented or automated through the use of AI solutions. Now, I'm going to get into more of the opportunities in a second, but I want to take a quick moment to highlight why I think this time is different. Prior to working as the Director of Digital Health and AI Research here at Advisory Board, I worked in the radiology space at Advisory Board. That means that 8 years ago, I was doing radiology research, and AI was coming up all the time. Of AI is going to replace radiologists was the line we I was always hearing, and didn't fully believe it. Still hasn't happened, but certainly AI has been a story in healthcare for a long time. Not trying to say this is brand new, but I do fundamentally think that we have hit a turning point, and that this time is different, and we are going to see sort of rapid adoption of AI solutions. Not at all trying to say they're going to replace staff, but certainly trying to say I think we will see widespread adoption and widespread augmentation of staff and clinical time. And there's three reasons for that. First, I think, is the increased computing power that allows for both rapid training, deployment, and use of these tools. The second is the increased size of large language models that we're seeing now. It allows for some of these chat functions to be used for a wide variety of chat specific use cases. So the size of ChatGPT, for example, allows it to be able to answer more questions correctly. And then third, and I think most importantly, is the democratized access. In the past few years, it has become a very real scenario that most people at an organization could have access to AI, a ChatGPT type function outside of their organization, use it in their free time, use it for free in their free time. And that is just something that is new in terms of the ability for everyday staff, for non-technical individuals to interact and interface with AI on a daily basis, not just in their background, telling them what they should watch on Netflix next, but directly interacting and chatting with AI. This access, I think, is going to fundamentally change sort of human relationships to AI, and the ability for more and more individuals to successfully sort of interact and become a power user of AI solutions. So let's talk opportunities and threats. So I think we're really at a turning point here in terms of where AI in healthcare is headed. On the one hand, I think this is very much a threat to the current sort of way that healthcare operates. We have early adopters who are moving heavily into the AI space, and we don't know how that will impact sort of their businesses. You could easily imagine a world where those early adopters are able to outpace their peers in cost and efficiency, and we see sort of growing gaps in capabilities and in revenues across the market. You could also imagine a world where AI solutions exacerbate some existing issues in healthcare, something like health inequities, reinforcing some of those health inequities, perhaps making them even worse. On the other hand, I think we really are looking at an existential opportunity here. There are some really difficult challenges to solve. There are challenges that have been around for decades at this point in healthcare that we haven't really moved the needle on, that I think AI does offer the opportunity to move the needle on, around patient care, patient flow, clinician burnout, recruitment. AI solutions, I think, offer an opportunity here to actually make a difference. And so with that in mind, I think it's really a question of how do organizations move forward to sort of capture that existential opportunity while avoiding some of the potential threats. I mentioned some of the potential consequences of moving on AI, that rich get richer, the unequal progress, the existing challenges and inequities. I think the one other thing I want to call out right away is that I think we're still waiting to see sort of how does this change sort of healthcare dynamics broadly in terms of sort of the power levers that organizations have. If you think about organizations that have access and own a lot of patient data and a lot of the health AI models, how can that power structure potentially change based on the use of those tools? It's an open question. I don't have any answers to it yet. It's something that advisory board will be monitoring over the next few years of what really is changing in terms of impact and patient care from some of these sort of life sciences organizations, for example, just as one example. But with that, want to move into opportunities and perhaps probably my favorite slide in the entire deck. So this is a slide that just highlights you have the patient care journey down the left side of the slide and some areas where AI is potentially already or in the future going to be help solve problems. I'm not going to talk through each one. We could be here a while if I was going to go through each of these. But a few that I like to highlight, detection and screening. I talked about sort of the radiology and my background there. I think imaging interpretation is fairly widespread, at least in terms of AI technologies at this point, in terms of helping radiologists out in that space. But that is not the only way that you could see AI sort of get involved in the detection. We've seen studies recently showing that some of these GPT technologies can accurately detect Alzheimer's from speech and text patterns. A wholly different way to think about detection, right? Not using a medical image, but just using data that is naturally sort of created every day in terms of text messages that are sent or audio recordings to be able to detect healthcare problems. Another example is visit documentation, ambient listening, and transcription, nuanced stacks. We have a case study on that coming up on the next slide. But I think it's a great example of another sort of widespread use case that we're starting to see really change sort of clinician relationships to AI. Speaking of DAX, for those who aren't aware, DAX stands for Dragon Ambient Listening. It is a nuanced product in partnership with Microsoft, and it is a solution that records the patient-provider interaction and converts it into clinical notes and clinical documentation. So providers pull up the DAX app on their phone. They inform the patient that they're going to be using this and recording the visit, and then they don't have to take notes during the visit. You can see some numbers on the right-hand side of the slide in terms of outcomes. I think the biggest ones I want to call out is almost 80% of clinicians reporting a better work-life balance and 80% of patients saying their physician is more focused. I think the documentation time reductions, the time saving per patient encounter, that is important. I think the bigger thing I want to call out is that by doing this, clinicians are able to, instead of staring at a computer screen, typing into a laptop, they're able to just have a conversation with the patient and know that those notes are being captured. The other important thing is that when you have sort of DAX capturing these notes, there's actually sort of reported improved documentation quality. And this improved documentation quality can support further AI solutions in the future. As you think about incorporating AI across multiple parts of an organization and multiple parts of a clinical journey, having sort of improved note quality can also lead to sort of improved discharge instructions, for example, if AI is helping with those. So you can imagine a world where DAX is sort of one step in the process to a larger sort of AI transformation. Certainly not the only place we're seeing AI and generative AI used. Epic has rolled out a variety of generative AI uses to help with sort of the administrative efficiency world. Epic's certainly not the only one. I just pull these in as easy examples. Responding to in-basket messages, sort of allowing clinicians to get an AI to generate a personalized response to those messages instead of having to type it out themselves, nursing notes, patient summaries. Really, I think the world is continuing to find ways to automate some of these sort of note generation and sort of text requirements that are put on so many clinicians and on healthcare staff. Again, just a few examples here. I think the bigger message and the bigger takeaway I would have is there are way too many opportunities and way too many cases for me to cover. I'll touch on this more later, but don't take these as being the only ones to go look for. Instead, take them as just a way to get ideas flowing about how you could potentially be using AI at your organization. The third one I want to touch on is actually predictive AI, so not generative AI. And I put this in here specifically because I don't want sort of this whole sort of presentation to leave people thinking, okay, generative is where I need to be. I actually think predictive AI in many ways offers sort of better sort of immediate ROI, or at least clearer immediate ROI than generative AI in many cases. And I think predictive AI still has a very useful role to play in terms of improving healthcare. And this is a great example coming from UNC Health in Geisinger, where they're using an AI model that looks at over 800 factors across patients with chronic conditions that have a high risk for an adverse event or for an emergency room admission. And it calls through sort of that large group of patients that they're flagging as high risk and identifies the highest risks. And then those highest risk patients are then sent to a case manager who can interact with a patient. So all AI is really doing here is flagging for the case managers who are the most important patients for them to reach out to. So you can imagine a world where a case manager is looking at a list saying, there's no way I have time to reach out to all these patients. This AI is helping them sort of stratify, okay, these are the most important patients to reach out to. And over 60 days, Geisinger and UNC Health saw a 10% reduction in avoidable ED visits among that group of patients. As I mentioned, those are not the only sort of solutions out there. There's so many, way too many for me to list. We put together another sort of look at sort of where generative AI is taking things. We have examples of tools that are out there today, some that are, potentially in pilots right now or coming soon at the next level, and then looking very long term, what are the potential moonshots here? The way I would think about this and the way I recommend thinking about adoption in general is less, how do I go adopt this moonshot or this next level right now, but more how do I set my organization up for success so that when this does become available and it does make sense for us to adopt, we are ready. So plenty of opportunities, but I don't want this presentation to come across just as, oh, there's so many opportunities, this is so easy. I acknowledge that there are tons of challenges in the AI space, and many challenges that are going to be hard for organizations to overcome. I use this slide to sort of illustrate those challenges, those numerous challenges that are out there. So on this slide, you're seeing a screenshot from Doximity's Docs GPT platform. It's a generative AI platform that allows physicians an easy way to do some of the administrative tasks that we've been talking about. A statement of support for Social Security, disability, type up some home care instructions. Seems pretty useful, right? But I love that on the right-hand side of this screenshot, you see that it offers a free fax service. So you can have generative AI write up your home care instructions, and then you can fax it out somewhere. I think this illustrates that even as we go adopt new technologies, we are still often fitting them into antiquated, outdated processes, fitting them into sort of older technologies where they may not have sort of an easy connection or fit in very easily. And this is something that organizations are going to have to continue to deal with throughout sort of the next 5-10 years as we continue to see AI adoption, because we know you're not going to be able to transform every process along the way, and you're going to have to fit some of these tools into your existing workflows. There are also some AI specific challenges. So it's not just that, we have AI technology, but then technology we have to fit it into. When it comes to adopting AI, we also know that things like data bias, accuracy, drift, reliability, over-reliance, reliability challenges are all very apparent as well, and are top of mind for many organizations as they consider, is it worth the risk of us to adopt right now or not? Data bias, I think, is the number one concern when I talk to organizations out in the market, and I think with good reason. So AI models can bring in bias from their biased training data. And there's a variety of ways that happens. I think the most common and one of the most discussed is just an issue of sample bias, which means there's a lack of representation in the data set based on compared to where the environment that model will eventually run. So if you think about a model that is trained on sort of patients in Minneapolis versus that will then be deployed in Miami, different populations, different demographics, that could lead to sample bias when the model is actually deployed in Miami. This is something that is difficult to overcome. I think the biggest priority is first making sure that AI models are trained on representative data sets and very large data sets to avoid some of this. I think the secondary thing is tuning models to specific organizations, and that requires expertise, that requires time. And it's going to be a continued, I think, small barrier for some organizations preventing adoption, or at least that should slow down some adoption if they aren't able to address it. I also want to talk about liability because I think this is another big area of focus. And really, right now, I think there's been limited guidance. We've had some memos from the Biden administration and from CMS around the use of AI, the need for responsible use of AI, but there's not really been any hard and fast sort of rules on sort of what this means and what sort of the process that should be put in place to mitigate against potential bias in an AI solution. I think this can put leaders in a tough situation, right? Where you're having to make decisions without fully understanding the potential liability that could come down in the future. The biggest thing I would say is that it means you should focus on governance, on making sure you do have the expertise to interact with a vendor and ask about the training data set, ask about data bias, have those conversations to ensure that your organization is doing what it can to limit your potential liability in the future. With that in mind, I want to turn to our last section of the day, really around how do you start to make some of these decisions, both around should we adopt AI or not? How do we determine what the right AI solution is for us to adopt? How do I choose a partner? How do I, develop the change management and the staff and the resources? And I think the first question here is, is early adoption worth the associated risk? I think there's many pros out there to early adoption. Efficiency gains, cost effectiveness. You're creating and giving yourself more time to build cultural and literacy around AI. Even if the ROI you're going to see from a solution you adopt today is, let's say it's good but not great, you're setting yourself up for being able to adopt more solutions in the future if you start today and build some of that organizational culture. But there are certainly cons. I think the first and the biggest is risk tolerance, right? These are riskier tools. I think it's both risky from a sense of not always being able to fully understand what the ROI will be. It can also be risky from the potential for bias. So understanding your organization's risk tolerance, having conversations with vendors about what the risk could be, certainly very important. I also think the another big con is the ability to pilot and pivot quickly as needed. This is not a skill that all organizations have at the moment. And so you risk some things going wrong in the pilot stage if you aren't ready to sort of learn fast and pivot with a vendor. So I flipped this slide and you're probably thinking, why is it blank? Well, it's blank because I truly believe there is no best AI strategy? It's a question I am often asked. I am sure it's a question that many of you have heard from members of your organization of what's our AI strategy? How should we develop our AI strategy? I don't think organizations should go out into the market with a specific AI strategy of here's the AI we're going to adopt first, then this, and we're going to do it in this way so that we are improving and learning how to adopt AI. Instead, I think organizations should be approaching this as we already have a strategy. We sit down and build out a 5 and 10-year plan. We have entire arms of our organization that are focused on strategic planning. Let's take what they have done and see where AI can help us within that. And that's what you see on this slide. So actually, the best AI strategy is just your existing organizational strategy, and then identifying the areas that AI can support that organizational strategy. Once you've done that, then the key becomes sort of this third bucket on the bottom, developing an adoption strategy. So what is your strategy around evaluation, governance, change management? That is much more important than developing an AI strategy itself. And as you think about sort of your existing strategic priorities, your biggest challenges of your organization, and where AI might be able to solve, it's very important to think of the root causes of some of those challenges. I love this slide because it really lays out how you can think about a specific goal, maybe the root cause behind that challenge, and then the technology investment. Let's take improving patient experience. Let's say your organization has a goal of improving patient experience. There's many different reasons why you might want to improve your patient experience. So you dig in, you say, okay, what is the root cause? Why are we saying we want to improve patient experience? We're getting a lot of feedback from patients. They're feeling unheard. If that is the specific reason, maybe we turn to that ambient listening technology that I talked about earlier, right? Because that would sort of fundamentally change the patient-clinician relationship. It's just one example. I sort of recommend every organization go do this. And then after you do that, I recommend discussing responsible use as an organization. It's not just around data bias, it's around the ethical implications of using AI in different use cases. It's thinking about the unintended consequences that could potentially come from using an AI solution. It also is very much around continuously monitoring and reviewing tools for AI drift, understanding that this is not just okay, we made a decision, we're moving forward with this AI solution, we're good to go, but that you will need to continuously monitor over time. And then finally, it's also providing transparency. So communicating to the relevant stakeholders, to patients, about the use of AI, about how you are mitigating its bias, about how you are continuously monitoring. And to do so, I think organizations, and to really build out that ability to adopt AI responsibly, organizations need to move incrementally. In healthcare, we have this idea of fast followers versus early adopters, and where do you want to fall? I think, particular with AI solutions, you don't really want to be an early mover or a fast follower. Now, if there's any organizations on the line that do consider themselves early movers, that's okay. I think, if you have the data scientists, you have the expertise, the research arm to be an early mover in AI, that is great. I think there are very few organizations that can successfully operate as an early mover here. Fast followers, those who are going to wait, see what happens with early movers, and then start to move after they see sort of success stories, I think AI requires too much sort of internal cultural change, too much sort of governance organizations that you're going to have to stand up in order to successfully be a fast follower. So that is why I'm pitching sort of this third path of incremental movement. And what I mean by this third path is this idea of not sitting around and waiting, but starting to, today, if you haven't yet, prepare sort of your data architecture, some of your staff for AI investing in education, data management, starting to fill gaps in your evaluation and governance process, going to your existing governance structures, seeing, Do we need to adapt this at all to make it work for AI solutions that we're considering adopting? And then move on a low risk use case after you've done that. That might be earlier than you otherwise would move as a fast follower. But if you've successfully built out that evaluation and governance and identified a low risk use case, it's low risk. And this use case should allow your organization to understand, is our training working? Is our governance process working? What went well? What went wrong? Where should we move next? And it's this iterative process that I think if you start now will actually set your organization up for more success in AI in the future. Help with some of that cultural learning. So I recommend organizations, if you have been in more of a wait and see mode, I'm not saying run out and adopt something tomorrow, but I am saying start the process of getting prepared for adoption. And you'll probably find that there is a low risk use case out there too. Maybe it's something that's not patient facing, something that helps just on the back end, your staff. Find one of those and start to move on it, because I think you will start to get some of that cultural learning that'll be necessary for when 5 years down the line, there's a huge transformative AI solution that you want to be able to adopt pretty quickly. To end today, before we get into Q&A, I want to highlight an example of one organization moving sort of across that stepwise approach, and this is Duke. So Duke's approach to AI implementation started 10 plus years ago. In many ways, they are an early adopter, but I highlight them specifically because they followed that path I just showed. So first, they really focused on AI governance. They took their existing governance structure, they built it out to specifically be able to evaluate and monitor AI solutions, both to focus on that these models are safe, free from bias, but also have a return on investment. From there, they prioritized simple use cases. So they were able to use that governance structure to identify the low risk use cases that can be piloted, evaluated pretty quickly, don't require a ton of development time, are less risky in terms of the monitoring that they need. And then they can provide training and education around these solutions to sort of build up their people's expertise in AI, in interacting with AI solutions. You can see some examples from some of their low risk use cases: sepsis watch, a schedule for the operating room, patient triage, and helping on the back end there. All of these are relatively low risk solutions, but provide sort of multiple learnings along the way. If you want more information on Duke Health, I'm going to skip a few slides here that go into more detail, but we also have plenty of information and a full case study on Advisory Board's website. So if you are interested, feel free to check that out. With that, I want to click into some parting thoughts before we get into Q&A. And as a reminder, if you do have any questions, please start to throw that into the Q&A panel. But as we wrap up today, I want to leave you with 3 parting thoughts. The first is, don't think of AI as an existential threat. Be aware of the threats, be aware of the things that could go wrong, like bias and like exacerbating health inequities, but focus on the potential. We need organizations who see the potential in AI, who are willing to move in the direction of adopting AI, that also understand the threats to be moving in that direction. That is sort of the way that as an industry, we will sort of tackle some of the challenges around responsible use and ensure that they actually happen. So don't get so focused on the threats that you fail to see the potential opportunity here. The second, the best AI strategy is the strategy you already have. Use AI to support your existing strategy. Instead, devote the time and resources around AI towards getting a process for adoption and a governance process. That is where you should be spending your time in AI. And third, don't wait to act. Again, not saying go out and adopt a solution tomorrow if you're not ready, but start to take that incremental approach to adoption. Prepare your organization. Take some of those steps across the rest of this year into next year, and then be ready to move on a low risk use case. With that, I want to flip into some Q&A. So I'll pull up some of the questions here. And yeah, please keep throwing those questions in. So see one question here around using AI for helping clients quit tobacco use. Happy to chat through that. I don't know of a specific sort of a use case around that, but I do think in general, there is quite a bit that can be done with AI in terms of supporting interaction more regularly and more frequently with patients. So if you think about something like quitting tobacco use or any other condition where you want to be checking in with a patient pretty regularly and interacting with them, AI and automation offers a ton of solutions around getting more data points on that patient, having more sort of interactions with those patients. And so in that sense, I think it very much could help just in terms of a regular touch point or something that a patient could write into with questions about, for example. See a question here from Ryan, recommendations for developing a governance structure. First recommendation, don't start from scratch. I am sure your organization has existing governance structures for sort of other technology adoptions. That is the best place to start. Don't sort of go try to create something brand new from scratch when you have an existing sort of governance structure. The important thing is sort of adjusting that governance structure for the needs around AI. I think a couple of examples that I've heard is first, how do you adjust the governance structure to be able to more regularly monitor solutions, not just for their ROI, but for something like data bias. Another example would be where, to Sean's point at the start, there's so many organizations that are being inundated with sort of information on AI, and lots of organizations where staff are bringing and clinicians are bringing AI solutions to sort of the IT space, saying we should adopt this. So being able to create a sort of new intake process even can be very important in the AI world. The other thing I will recommend is that there are multiple organizations out there that are publishing and building out examples of sort of good AI governance. Chai is one example, CHAI, and Train are two organizations that I've interacted with and read some of their governance information online that I highly recommend checking out if your organization is looking to go in that direction. Seeing question here, can AI be used for advising customers on their healthcare recommendations, such as prevention and precision medicine? Certainly. I think this is a place we are going to continue to see quite a bit of growth. If you think about the idea of precision medicine and being able to create sort of more customized healthcare journeys for patients and individuals. There are two sort of aspects of that AI can very much help with. One, if you think about that goal, it can be very difficult to efficiently do that. Clinicians do not have time to necessarily create those customized journeys for everyone. That's not a way that healthcare operates today in many ways operationally. And so if you think about the efficiency gains that can come from many of these AI solutions, that's one way they can support it. I think the other big way is in the sort of massive amounts of data they're able to sort of interact with and pull sort of insights from. So if you think about something like a rare disease, for example, if we have a large enough data set, we might be able to actually identify enough patients with a certain rare disease so we start to see what different clinical treatments do and impact and the impacts they have, and then develop more sort of precision medicine for those patients. And that's not even getting into sort of using genetics and other things as well. So I think there's quite a bit we'll see there in the next few years in the AI space. Question around patient satisfaction improvement with providers using DAX for notes. Have you polled patients on satisfaction and adoption of AI healthcare journey tools such as scheduling, prescription refill, insurance, billing? I would say on the advisory board side, I've anecdotally heard that that is a big sort of reason for investments in some of these spaces. Do not have a case study with specific data points there. But I certainly think that in general, we are seeing in more and more spaces outside of healthcare, AI being used to support sort of digital consumer interactions, right? We are getting more accustomed as individuals to having sort of our answers and our problem solved quickly in our different consumer journeys with the help of AI. I think consumers are going to start to bring those expectations more and more into the healthcare space, and that being able to meet those expectations is going to be a huge aspect of maintaining and improving patient satisfaction as we go forward. See a question here. Do you foresee pushback from clinical staff when AI truly starts to enter into clinical areas? Example, California nurses starting to protest once AI entered into their workflows. I think, as with any sort of major new technology, you are going to see some pushback and hesitancy. I think this comes back in some ways just to your classic change management techniques. Are you going to be able to sort of have a clinician champion who champions the technology and sort of brings potentially detractors along with the journey? I think another big thing that I think is important to focus on for staff specifically is showing not like here's what it's going to do that you used to do, but instead here's how it will make your life better. An example, in terms of the ambient listening documentation or even some of the in-basket messaging technology we're seeing, is interacting with clinicians of asking them about, okay, how much of your PJ time is this tool able to take away? So your need to edit notes or respond to in-basket messages when you're at home with family. And having those kind of interactions of how is this supporting your work-life balance? How is this changing your fundamental relationship to the tasks you are asked to do every day? I think is a powerful way to start to sort of talk through some of that hesitancy. I think it's inevitably going to be there. I think that the right way to approach it is transparency and an open conversation, as opposed to just trying to implement the AI with limited conversation, limited transparency, and hope staff will be on board.
Can you hear me?
Yes.
There was one question I don't know that we got to about AI agents. Are we closer to having the ability to have smarter AI agents? So I didn't know if you wanted to wrap up with that one. I know from our perspective, right, we are working diligently to help agents by one, automating ton of stuff that can be done without any agent interaction, reducing 30 to 40% of calls that come in there. And then I know we'll be launching our voice AI solution in the near future that can actually have those intelligent conversations with a true AI-driven agent. So don't know if you have more to add on that, but I just wanted to jump in on that one.
Appreciate it, Sean. I'd say the only thing I would add is, I think from the sort of technology basis, we're going to continue to see improvements in natural language processing and in some of those large language models to allow, I would say, year over year efficiency improvements and improvements in sort of the types of conversations and interactions those agents will be able to take on. So I think this is, if you think about where are we going to see the most improvements over the next few years, that would be one of the areas I would highlight. Anything that's using some of these natural language processing solutions, that's already in many ways ready for prime time, but I think we'll continue to see growth in the ability and the variety of conversations that those solutions will be able to take on.
Thank you.
And I don't see any other questions coming in. So Sean, I can pass it over to you to quickly wrap up if you want.
Yeah, well, one, just wanted to thank you so much, Ty. I think that information's incredible, really helping me distill down a lot of this, and I hope it helped folks out to understand, where they are on that journey and how to move to the next step. So really appreciate your time, appreciate everybody's time that joined or will be listening to this afterwards. Up on the screen right now, you'll see a QR code. So if you have any questions for us specifically, that's Healthgrades and MedChat AI, you can scan that, get in touch. And then obviously the advisory board is a wealth of information on their site with all the case studies and more that Ty went through today. So we always appreciate your partnership as well and the expertise.
Thanks so much, Sean. And thanks everyone for being here.